want strong immune systems. I don't want to hide in my home, develop a weak immune system, and then come out and get disease. We have both been in the ER through swine flu and through bird flu. Did we shut down for those? Were they much less dangerous than COVID? Is the flu less dangerous than COVID? Let's look at the death rates. No, it's not. They're similar in prevalence and in death rate. So we are saying that our response now that we know the facts, it's time to get back to work. It's time to test people. But again, testing gives you a moment in time. Testing tells you, the nasal swab says positive or negative. The blood vial, the tiger top or the finger stick gives you IgG, IgM. IgG being the long-term immunoglobulin we look at for immunity. But again, it's a moment in time. And what's interesting to me too is when someone dies in this country right now, they're not talking about the high blood pressure, the diabetes, the stroke. They say, did they die from COVID? We've been to hundreds of autopsies. You don't talk about one thing. You talk about comorbidities. Their vessels were narrowed. Their lungs were a smoker. COVID was part of it. It is not the reason they died, folks. It is one of many reasons. So to be so simplistic to say that's a COVID death because they have COVID, you know how many people die with pneumonia or people that die from flu, with flu I should say, it's not from flu. Their lungs were compromised by COPD. They had a heart attack 2 years ago. They have a weakened body. We aren't pressured to test for flu, but ER doctors now, my friends that I talk to say, you know, it's interesting. When I'm writing up my death report, I'm being pressured to add COVID. Why is that? Why are we being pressured to add COVID to maybe increase the numbers and make it look a little bit worse than it is? I think so. So this is what I'm hearing from physicians I talk to in Wisconsin, New York, and everywhere.
So you think that physicians are being pressured to make the numbers look worse than they are?
They're being pressured to add it to their diagnostic list.
And
so
where is that pressure coming from, in your opinion?
Well, I probably coming from the administration. So their administration is saying,
or the Newsom administration?
It's probably coming from the hospital administration. I didn't ask them specifically, but they said we're being pressured in-house to add COVID to the diagnostic list when we think it has nothing to do with the actual cause of death.
You can't confirm that beyond their work.
The actual cause of death was not COVID, but it's being reported as one of the disease processes and being added to the death list. When they died from COPD, they had COVID. COVID didn't kill them. 25 years of tobacco use killed them.
Yeah, that's actually interesting. So I guess my question right off of that is, I know that right now what we're discussing isn't really anything new. There's people with immune deficiencies who COVID just supplements whatever illness they're dealing with, and that's contributing to their, to their death. So going back to what I think the theme is here is quarantining and social distancing, is it necessary? So my question is it necessary are you saying it's only necessary for some individuals to be quarantining, but for healthy individuals, it's not?
Yeah, exactly. I mean, why would you quarantine the healthy? If you're young and healthy, why would you quarantine yourself? It doesn't make any sense. You quarantine the ill. And
well,
we were.
Don't they say that one of the reasons to do that is because, so many people are asymptomatic, and then they may take it home and spread it to someone who is immunocompromised.
Sure.
I mean, isn't that part of the reasoning?
25% of patients who have COVID are asymptomatic, which is why we advocate for widespread testing. In order to open the economy, you have to have widespread testing. That's number one, no question about it. But historically, if you look at biblical times, you look at leprosy, Mycobacterium leprae, which is the bacteria that causes it. They isolated the sick. They didn't isolate everybody else. So isolating the healthy just doesn't make sense, in our opinion.
So you guys think herd immunity is kind of the way to go then?
Absolutely.
I think so.
There's two ways. Well, there's two ways to get rid of a virus, right? Either it burns itself out or herd immunity. For hundreds of years, we relied on herd immunity. Viruses kill people. End of story. The flu kills people. COVID kills people. But for the rest of us, we develop herd immunity. We develop the ability to take this virus in and defeat it. And for the vast majority, 95% of those around the globe, this is true. And when we look at people that have locked down and people that haven't locked down, we have massive data. It is not statistically significant whether you lock down or not. So why are we doing it?
Do you think it's safe for the state to lift the lockdown?
Yes.
Would it be safe for people to be
Yes.
outside right now?
Yes. I'm outside with no mask.
Are the gloves and masks maybe a little bit too much right now? Is that kind of what you're saying in some
Well,
sense?
again, do you want your immune system built or do you want it not built? The building blocks of your immune system is virus and bacteria, end of story. That's how you build it.
And there's normal bacteria and normal flora. There's normal bacteria and normal flora that we have to be exposed to. Bacteria and viruses that are not virulent are our friends. They protect us against bad bacteria and bad viruses. So right now, if you look at Dr. Erickson's skin or my skin, we have strep, we have staph. All staph isn't bad, all strep isn't bad. They protect us against opportunistic infections. That's why when a baby comes out of the womb for the first 3 to 6 months, they're extremely vulnerable to opportunistic infections, which is why when we see a little baby in the ER with fever that's 1 month old, you do a spinal tap, you do a chest x-ray, you do blood cultures, you do urine cultures. But if you had a fever, I wouldn't do that for you. Why? Because that baby does not have the normal bacteria and flora from the community, whereas you do, because you've interacted with, you've gone to the gas station, you've gone to Home Depot. That's the difference. Normal flora, we all need normal flora. What Dr. Erickson's saying is when you are self-isolating at home for 2 or 3 months, you lose that normal flora. So I guarantee when we reopen, there's going to be a huge amount of illness that's going to be rampant because our immune systems have weakened. And that's just basic immunology and virology.
I just wanted to ask Dr. Erickson if you were done with your presentation or if you had more things to talk about, because I'm
let's see here.
saving my questions for the end, and I just wanted to make sure.
I had some conclusions, but basically our conclusions are that when I look at the basic tenets that we know of microbiology, and I say, do we need to still shelter in place? Our answer is emphatically no. Do we need businesses to be shut down? Emphatically no. Do we need to test them and get them back to work? Yes, we do. The secondary effects that we went over, the child abuse, alcoholism, loss of revenue, all these are, in our opinion, a significantly more detrimental thing to society than a virus that is proven similar in nature to the seasonal flu we have every year. We also need to put measures in place so economic shutdown like this does not happen again. We want to make sure we understand that quarantining the sick is what we do, not quarantining the healthy. We need to make sure if you're gonna dance on someone's constitutional rights, you better have a good reason. You better have a really good scientific reason and not just theory. We're going to work diligently to find a vaccine. And one of the most important things is we need our hospitals back up. We need our furloughed doctors back. We need our nurses back, because when we lift this thing, we're going to need all hands on deck. I know that the local hospitals have closed 2 floors. Folks, that's not the situation you want. We're essentially setting ourselves up to have minimal staff, and we're going to have significant disease. That's the wrong combination. So that's kind of the gist of what we wanted to get across today. And I've been working with some of the leaders, and I've talked to the head of the CDPH. I've gotten their opinion on this, and a lot of the leaders in Sacramento. And we're all in agreement. But we need to have Governor Newsom in agreement with us to lift this ban. I've talked to our local head of the health department, and he's waiting for that. Even though they're in agreement with me, they're waiting for the powers that be to lift. Because the data is showing us it's time to lift. So if we don't lift, what is the reason?
Well, I want to ask you about testing here in Kern County. We have, according to Public Health, just under 3,600 pending tests. If you compare that as percentage to the rest of the state, that's very high, given we have 900,000 people in the state of 39.5 million. I know you're not Public Health. Why is our testing, the speed at which it gets done here in Kern County seemingly so bad?
Well, demand. Unless you're going to grab people from their homes, people are afraid. They're sheltering in place. They're having problems with their diabetes and they won't come in. Do you think they're going to come in for a test? Not in your life. They're sheltering at home. So a lot of times you've probably seen our marketing. We do coronavirus testing. We've called the major businesses. You have to have people actually come to perform the test. If they're afraid to come in, which a lot of people are, we can't get the data.
So you're talking about the medical staff as afraid to come in?
No, the patients.
Well, what I'm saying is that we have just under 3,600 pending tests. People
Right.
who have been tested, but they haven't gotten their results yet back. That's about half of all of California.
What's the
Why are
time
we
frame?
so slow?
What's the time frame on that?
So this is, according to public health, this was updated this morning at 10 o'clock.
But when were they tested? I mean, it's
That I don't know.
well, that's the most important. That's the most important piece of
But
data.
why does a place like Los Angeles County, which has 10.1 million people, have a smaller percentage of pending tests than a
They
place
do.
like Kern?
How many tests do they do?
Well, I'll piggyback right off of that. So, I mean, if you look at the pending tests within the last 10 days versus the amount of negative and positive cases the county's reporting, it seems like it varies maybe 150 to 200 reports coming in a day, and that large number of just over 3,000 over 3,500 is still there.
Yeah.
So this idea of let's test everybody, do we even have the capacity to do that?
I mean, even if they tested every single person here, there's 900,000 people in Kern County. There's 10.1 million in LA County. So why is Kern County seemingly lagging as opposed to other counties in California? And again, I appreciate that this isn't
No, of
your
course.
fault. You know,
No, it's not about a fault. This is a discussion. We do the majority of testing in Kern County for COVID. We do the majority of testing. And our folks, we have a couple hundred employees, are working night and day to serve this community. So we're at full speed. We can handle a lot more testing. We're seeing about half the volume we normally see. We can double our volume and still take care of, getting the results back. Unfortunately, we don't run them in-house. Nobody does. We depend on major labs that are huge players in the United States. So our job is to evaluate the patient, make sure it's they don't have any other issues, tonsillitis, pneumonia, flu, swab them for COVID, send them to the lab. The lag from the time they get it to the result is usually 2 days. It's a 2-day result, which is in line with everywhere else.
That
So
doesn't, that doesn't seem to be though. I mean, the variation is 150 to 200 within the last 10 days. I mean, they've been sitting with over 3,000 pending tests for a while now. So, how many people have you tested? Did you guys say? You
Five
Yeah,
thousand.
we went over the numbers. I'll give them to you one more time. We've tested 5,213. We've had 340 positives. Now, we have people calling back from 7 in the morning till midnight. We can only speak to our data collection. Initially, the labs were taking 10 to 12 days to get results. That was about 6 weeks ago. Then they refined their process. They brought in more analyzers. So they automated. They were doing things manually. They automated the process, and now it's 1 to 3 days. All of our data is followed up on. These 5,213, these are called back. We do between 150 and 200 tests every single day of the week, including weekends. We have people calling back till midnight, every single patient. Our data is followed up on. I can't speak to what LA people are doing. I know what we're doing here. These tests have been followed up on. These tests are accurate to date. And if you look at the pending tests, 5,213 is a majority of them. So I know our processes. Maybe the hospitals are not sending them stat. I don't know. But our data is coming around 1 to 3 days.
Got it. So you're
That's
saying
okay.
there's
What'd you
no
say?
backlog for you guys?
No, not at all.
Based on your information, would you say it's safe to open up schools, sporting events, and for people to gather outside again, including gyms?
Yeah, I would start slowly. I think we need to open up the schools, start getting kids back to the immune system. And the major events, the sporting events, these are non-essential. Let's get back to those slowly. Let's start with schools. Let's start with Cafe Rio and the pizza place here, because I can go into Sully's right now, which I did this morning. There was 25 people in there, and I can stand in line for 10 minutes, but I can't go in Cafe Rio and sit there for 10 minutes. Does that make sense to you guys? And I can go into Costco and I can shop with people, and there's probably a couple hundred people, but I can't go in Cafe Rio. So big businesses are open, little businesses are not. There's no science behind that. As we've gone over, that is not science. There's other factors in play that we don't have time to go into, but it's not science. I want to make that clear.
So you're saying, I'm curious what you think needs to happen, or if someone came to you, the county, and said, what should we do to reopen? Because you said you think testing is important, but are you saying, it sounds like you're saying a slow reopening, starting with the most essential things and working from there. And then how would you propose doing wide-scale testing?
Well, and I've met with all the CEOs in all the hospitals as early as yesterday, and I've met a couple times, and they've said, what's your capacity? We're trying to figure out our capacity. So it's an ongoing discussion, and from our perspective, we've said, let's start back opening the businesses up. People need revenue. They need the food chain. For instance, your Grimway, your Bolthouse, they have thousands of employees. Well, they're all working. Have they all been tested? So our thing is start with the food industry and the food chain, test them, and what we're trying to do now is validate a finger stick test so that we can test people in 3 minutes. They're just coming out. So we're actually at noon today, we're supposed to meet with a major lab talking about running the TigerTop, which is the blood tube alongside the finger test, doing our self-validation over the next week or two, getting that rapid test done so that people can test as they go into work. Boom, 3 minutes, negative, come. And we do that until we find out who has active disease, who's not, and we don't have to do everyone, but a majority of players, and then eventually we treat this like we treat flu, which is if you have the flu and you're feeling fever and body aches, you just stay home. If you have cough, fever, shortness of breath, COVID is more of a respiratory thing, you stay home. You don't get tested. Even when people come with flu, a lot of times we don't test them. We go, you have flu. Here's a medication, or if it's been more than 2 days, you don't get Tamiflu, it works itself out. This virus is the same. You have COVID, go home, let it resolve, and come back.
So someone who would test negative for the antibodies, should they be allowed to go back to work?
They should, because they may be negative for the antibody for years. They may never get flu. We have people in their 50s who have never had flu.
So you're just saying anybody who doesn't have an active coronavirus infection should be allowed to go back to
Absolutely.
work, whether they have the antibodies for it or not?
Right.
Okay.
But you're saying that once we have the testing in place, is that correct?
Well, if you have no symptoms, you should be able to return to work. Are you an asymptomatic viral shedder? Maybe, but we can't test all of humanity.
Well, I think one thing I also wanted to add is we're going to miss cases. Sure, we're going to miss cases of coronavirus, just like we miss cases of the flu. I think one thing that is being televised is that we need to capture every single coronavirus patient. No, we don't, because that's not reality. Theory and reality are very, very different. We worked in ERs for 15 years. Theory and reality are very different. It would be nice to capture every coronavirus patient, yes, but is that realistic? Are we going to keep the economy shut down for 2 years and vaccinate everybody? That's an unrealistic expectation, I think. So you're going to cause financial ruin, domestic violence, suicide, rape, violence, and what are you going to get out of it? You're still going to miss a lot of cases. So we need to treat this like the flu, which is familiar. And eventually, this will mutate and become less and less virulent. Because patients who are asymptomatic or silent shedders usually have the milder version of the coronavirus, right? Because it's milder, that's why they're not as symptomatic. And that tends to spread quicker than the more virulent forms.
Karen Flaw, I'm sorry, from KGT gave me some questions to ask. One of them was, what sources do you cite to back your claims? What scientific papers and studies can you send out to us? Are there other people?
This is too early. Scientific studies, double-blind clinical controlled trials take time, years. So we're doing the best with the data we have. I gave you the statistics. This is all common knowledge you can find online. This is their countries reporting to these different news entities. This is all common knowledge. This is not based on double-blind clinical controlled trials. Again, we've been studying microbiology for 20 years. This is our life goal. In our 20s and 30s, 40s, this is what we do. We throw this information against the backdrop of knowledge. We both have degrees in this and say, is this legitimate? I don't need a double-blind clinically controlled trial to tell me if sheltering in place is appropriate. That is a college-level understanding of microbiology.
That's next year. Next year, 2 years down the line. A lot of times in medicine, you have to make educated decisions with the data that you have. I can sit up, and in the 47th floor in the penthouse and say, we should do this, this, and this, but I haven't seen a patient for 20 years. That's not realistic. We're using the basic data that we have here, which we're happy to share with you guys. We have all the data. This is our data from Kern County. And because we're the largest testing center for Kern County, we're assuming our data is accurate for this specific area.
How many tests have you guys done, and how many of your tests have come out positive?
5,000. We've done 5,236.
5,213.
I'm sorry.
That's okay. 5,213, and we have
40 positive.
340
6.5% is our number.
Is it coming to the point where it's getting unhealthy to stay inside and doing all these shelter-in-place orders?
I think so. I mean, sorry to cut you off. Your vitamin D levels go down. You're not outside. You're not, your mood goes down. When your mood goes down, you're more likely to get sick. You get depression. Going outside is healthy. I mean, why can't you go to the park and walk around, but you can go to Home Depot and nobody's wearing a mask? It doesn't make sense. The inconsistencies and the incongruencies make no sense. That's the bottom
So when
line.
Governor Newsom says restaurants, after the stay-at-home order, you might see waiters and waitresses wearing gloves and masks and giving you disposable menus, you guys disagree with that?
No, it's not. We don't disagree with that. I mean, I think you can look at it from two different ways. I think if you're healthy and you don't have significant comorbidities and you're not immunodeficient and you're not elderly, you should be able to go out without any gloves and without a mask. I think if you are those things, you should either shelter in place or wear a mask and gloves. I don't think everybody needs to wear a mask and gloves because it reduces your bacterial flora. It doesn't allow you to interact with society, and your bacteria flora and your viruses, your friends that protect you from other diseases, end up going away, and now you're more likely to get opportunistic infections that are hoping you don't have your good bugs fighting for you, if that makes sense.
So doctors, you guys are calling for, as you said, gradual opening up, and with that we have to increase our testing. But if you look at the numbers per capita, California is the 4th lowest state per capita testing. The U.S. is below almost every Western European nation per capita testing, minus I think the UK and France.
And Germany.
Places like, no, we're lower than everybody minus the UK and France per capita. I think we're about 12,500 per million, and UK and France are about 8,000.
Okay.
If you look at places like Germany and Denmark that are beginning to open up, their testing rates per capita are 3 times higher than what ours are. We also have their test positive rate is between 3 and 12%, which is what the World Health Organization says should be the positive rate. Ours is closer to 20% nationally. So at what stage do you think we get that adequate testing, which you guys are calling for, where we can start to take those approaches to get our economy moving again, start opening up?
Well, I think,
do you think we're there now or no?
I think that's an excellent question. I think the problem with wanting widespread testing versus not being scared enough to come to a facility to get widespread testing are two different things. If you're at home seeing tons and tons of people die, I don't want to go to Accelerated. I don't want to get testing. That fear prevents people from coming in. When this press conference is to give folks hope. It's okay to go to the doctor. It's okay to get care. If you have right lower quadrant abdominal pain and fever and your appendix is about to burst, but you're worried about COVID, you're going to stay home and die from sepsis. So I think we need to remove some of the fear that's a little inappropriate in my opinion and not justified medically. We need to remove that from society right now. We need to let people know, hey, it's okay to go to the doctor's office and get tested. We give everybody a mask when they come in, for their own peace of mind. So I think we're able to do mass testing. Right now, we can do 1,000 tests a day. The problem is people are scared to come in. They want testing. They're scared to come in.
So then why do you think different governors, Republican and Democrat, have come forward and said that they don't have the capability to do mass testing?
Well, I mean, what's the definition of mass testing? What do you define that as?
Enough people are tested where our positive test rate would decline, where our numbers per capita would equal those of other developed countries.
We have significant ability to test.
So then why do those governors say otherwise?
I don't know what models they're looking at and what facilities they're looking at. We spend night and day as owners of of our 7 facilities, night and day making sure we have enough tests. We have thousands and thousands of tests that are not being used. We're happy to test everybody. We just don't have the volume. And because of that, our business is suffering, and so is every other medical business in town, including the big hospitals.
Does insurance cover the testing? These
It does.
tests?
It does. Yep, it's just a copay.
And if you don't have insurance?
Then
what's
our
the
fees are
cost?
very, very reasonable. It's $175 before 5 and $200 after 5 and on weekends.
For all 3 tests?
Yes, well, the lab charges you for the tests. For our doctor to see you, for us to register you, for them to examine you, the evaluation and management, that's the fee. The lab will charge you. We don't know what the lab charges. I think it's $60 to $70 for the lab fee. But the insurance covers everything.
And another question from Karen Waugh was yesterday, the Board of Supervisors meeting, Matt Constantine, the head of Public Health Services, said that using a state model in our local data, that it was showing that we're tracking on this curve of about 40% social distancing, and that when we reach October, if we keep on that line, we will have so many cases that it will overwhelm our local hospitals. You know, he's using local data and a model that was put out by the state, and he's getting kind of a, you know, sort of scary prediction. I mean, what do you guys make of that? What do you think of that?
Well, I mean, I want to look at it from two different points of view. One is if we keep the economy shut down till October, what's going to happen? Homelessness is going to go up. People's lives are going to be ruined. And there's so many other secondary effects of COVID-19, which Dr. Erickson presented eloquently. I think you have to look at that, and then you have to look at what are we going to lose? Well, seasonal flu rises in October as well. What do we do every year with seasonal flu? Does everybody stay home? Did you stay home last year for seasonal flu? Did you, Tim? Did anybody stay home for No, this is just like the flu. Because it's unknown, it's not. The flu has been killing people for 100 years, since 1918, since the massive pandemic. But the flu is just, we know what the flu is. It's familiar to us. So we're not scared of it. Oh, it's just the flu. I've had several patients in their 30s and 40s die in the ER when I used to work in the ER from the flu. Oh, it's just the flu. But if it's coronavirus, it's coronavirus. We all need to be scared. So it's because it's unknown. The unknown always scares us. So in my opinion, what are the risks? What are the benefits of social isolation? And we think that the risks of social isolation are too high.
So you guys own and run this facility, is that correct?
Mm-hmm. We have 7, yes, all of them. Yep.
What would you say to critics who would say, well, they've got a stake in this game, they are pushing this data or their representation of this data because they don't want to lose money? What would you say to those folks who say, I'm going to believe, you know, maybe someone else who, you know, the wider world scientific community who says these two doctors, despite their, you know, intelligence, they have an ulterior motive? What would you say to those people?
Talk to ER doctors who have no ulterior motive. They have the same viewpoint. There's a post today from a doctor from Wisconsin. I encourage you all to read it. I'll share his story with you. It is exactly what we're saying. And he eloquently displays, he's an ER doctor. He says, I'm walking into this war zone. Our ICUs are empty. I'm scared to go to my own place of work. There's no patients, but we have people in hazmat suits checking my temperature as I walk through the doors. He's like, something else is going on here. This is not about science, and it's not even about COVID. When they use the word safe, if you listen to the word safe, that's about controlling you. So when I talk to all my ER doctors who work in a hospital, no stake in the game, same opinion. That's how I'll answer your question. We all have the same opinion.
So then you say that so hospitals are losing money right now, most of them. But at the same time, you said earlier that doctors are feeling pressure from hospital administrations to put COVID down as a reason of death, which would presumably instill more fear in people. Doesn't that go against that whole line of thought? Why would they do that if it was going to cause more fear and cause them to lose more money?
Exactly. There's something else going on, and that's a different discussion.
We don't know. I mean, we're just here to present the scientific
facts.
That's
a political discussion.
Yeah.
So you think some hospital administrators are undercutting their own bottom line?
We're presenting the medical data here. I mean, what I think about politics is irrelevant. We're presenting the medical data.
We need to stay on things that we can answer intelligently, which is not why does a CEO of some hospital in Wisconsin do that. We need to stay on the topic of, do we need to shelter in place, and does that make sense from the microbiology knowledge we've known for 30 years? The sciences haven't changed. We live our life in the life sciences. Biology, biochemistry, microbiology. So everything that you're asking us goes against that sheet of information. Why people do things at a hospital is not really our area of expertise. So from what we've seen right now, it's time to open back up. The science says it is. The models we have been using from predictions to predict the amount of disease are not accurate. This information is accurate. It models the flu. Let's go back to work. That's what the data is saying. Not models. Data is saying that.
say though that, I mean, like a situation in New York City, that's not like a flu. I mean, the hospitals there are completely overwhelmed and swamped, and people, you know, working in the ERs are dying from this. So, I mean, that's not just a flu type situation, right?
Look at Italy in 2017. Hospital systems overwhelmed, people dying, overwhelmed system from the flu. This happens from the flu. If you've been working in the ERs, I've seen multiple people, hallways full, people dying, news media there, stories going on from the flu. This does happen.
It does, okay. So
This does happen.
It's not just the flu, it's
No.
the flu. That's what I mean. That's exactly what I mean. People think it's just the flu. It's just coronavirus. What's the difference? You're used to the flu. You're used to saying it's just the flu. FLU, influenza, is something we've grown up with. You're used to it. You're used to it, right? If somebody commits suicide today, you're like, yeah, that person committed suicide, it's awful. Or if somebody dies today from the flu, they died from the flu. It's awful, terrible, but we're used to it. We're not used to coronavirus. Not used to something brings fear. Human beings don't
I
like
understand
change.
that. I just, you know, I mean, from the things that I've been reading, even, you know, doctors working in the ERs in New York City, I mean, I haven't heard any one of them saying, oh, it's similar to a flu outbreak. I mean, they were pretty impacted by swine flu in New York City, but I haven't heard anybody really say, oh, it's just like swine flu was. You know, I mean, have you?
And they're getting hit hard. They're a hot zone. And we don't ride subways with, 1,000 people in a small car that are this close. They had reasons for the disease. And coronavirus is shown to be very contagious. Let's be clear. It is contagious. We're not saying it's not. It may even be, from what I've read, more contagious and spread more rapid. But the actual cause of death and the disease cycle is similar to what we're seeing from the flu, with more of a respiratory component. And they were screaming for ventilators. What percent of people die on ventilators? 80, 90%? Once you're on a ventilator, if you understand, you're in a bad shape. And they're screaming for 30,000 ventilators that they didn't use, right? They're screaming for a lot of things. 30,000, they used 5. How many 100% over did they order? How many hundreds of millions of dollars? Entire companies, GM, were forced to switch their production lines. For what? I'm saying the secondary causes of what we're seeing, oil shutdown. We have predictable negatives from lockdown. Predictable negatives. Corona has unpredictable negatives.
No, I see what you're saying. I mean, it sounds like you're saying, we actually have some data to look at now, and in the beginning we didn't really know, but now we can draw some conclusions.
And those conclusions that you guys were able to draw, really the entire nation, do you think, respectively, the numbers are low in those ratios that you were mentioning, the fatality versus how many people have them, because we've been social distancing? No, you don't think it's because since we started doing these, that those models that Broward County Health shows how effective social distancing is, that's all false?
But that's why we went over Sweden and Norway. We went over Sweden and Norway because you have lockdown, no lockdown. Sweden, no lockdown. Norway, lockdown. That's 10 million, that's 15 million people. We have the data. That's what I just went over with you.
But by
Lockdown.
Norway and Sweden also have drastically different testing standards and metrics. Norway's basically testing everybody. Sweden, they're only testing you if you end up in a hospital.
No, that's not accurate. They're not testing everybody.
Well, of course they're not testing all 5.5 million Norwegians, but their testing is much more widespread.
The bottom line is, for those of us who study it and have a background in this, is lockdown versus non-lockdown did not produce a statistically different number of deaths. That is the bottom line.
That we know of.
Right,
So
so
people could be dying in their home or from other things, but if Sweden, if they're not being tested, then they don't know what the cause of death is.
Yeah, and if you were to give me a test on analyzing these numbers and trying to, I probably wouldn't perform so well. I guess what I'm trying to cross-reference is I hear our president, I hear our governor say social distancing is working. And you guys are saying it's not needed. So I guess that's what I'm trying to wrap my head around. Like, why is that?
It was needed initially.
Are they lying? Are they lying?
It was needed initially. They actually, we both agree with exactly what they did initially because we didn't know. It was an unknown. Now it is becoming known. Initially, when you don't know something, you're extra careful because you're fearful. It's just like when you see a patient and they're very sick, you test for everything because you're scared, you're fearful. But then as you see more of those patients, you realize, hey, I know what to test for, right? It's shotgun effect versus sniper effect, right? So initially when this data came out of a new virus that's lethal, they went all out. And I think that was appropriate. But now that we have the data, we're seeing that 97% of patients completely recover. And those 4 patients that die, they have over 90% comorbidities. Let's run through that one more time. Out of 100 people, if 96 do fine, the 4 that die, 90% of those 4 have comorbidities. Heart failure, emphysema, rheumatoid arthritis, lupus. They're on immunomodulating medications. They're immunodeficient, HIV. These are the people that are dying. You get some healthy people that die, but that's an infinitesimal number. Tiny.
So, and you think that differentiation of the conclusions that you doctors are drawing versus them is because they are academics or something along that line? What you were saying?
Well, I think we're in the weeds. We work with this every single day, and the numbers don't make sense to us. And they don't make sense to ER physicians and physicians all over the country. It's not just us.
Okay. And then my final question, just to make sure we get it right, I think you guys said this. Please get your first or last name or spelling, please. Your first or last name or spelling, please. Thank you, sir.
Dan Erickson, that's DANERICKSON.
Perfect, thank you.
Artin, ARTIN, MASSIHI.
Awesome, thank you guys.
Thank you guys.
Thanks for your time.
ARTIN?
Yes. Thanks, Ryan.
Hey guys, thank you so
Thank you
much.
so much. Appreciate you
And
guys.
you guys are the co-owners of
Yeah.
Accelerated Urgent Care? Okay. I'm just looking through to make sure that I answered all of Karen's questions.
We're not saying we're right. We're saying, here's the data, here's what we understand. It's not a you're right and you're wrong thing. It's the way we interpret data. We work in the field, and some people that are not working in the field and still getting a paycheck have a different opinion. If you weren't getting a paycheck, you might have a different opinion. If you weren't getting a paycheck, if everybody in here is getting a paycheck, right? Cafe Rio is not. They've all been furloughed. When you don't get a paycheck, your opinions start switching. If you were at home, furloughed, for the unforeseeable future, would you be excited about staying sheltering in place?
No, I mean, I completely understand. I mean, we're seeing this around the country now, I think, that people are demanding that they be allowed to go back to work and...
Well, it's also, at what point, who says what's safe? Are you smart enough to know what's safe for you? Or is the government going to tell you what's safe for you? Who tells you what's... As soon as they use the word safe, that means control. We know what's safe for you. You're too dumb to understand disease, you see. We know what's safe. And so they're going to use this model for different things. We got a bomb threat from China. Everybody stay in their home for 3 months. What? They are using this to see how much of their freedom can they take from you. And will you roll over and stay in your house? And it's working. And if you notice the way Americans are responding, if you go to any gun store in town, guess what they're out of? Ammo. None of them have ammo. I went to 3 of them. They said thousands of rounds have been bought. Why? People are mad. They're starting to post on my Facebook with their AKs going, let's roll. So what I'm saying is, let's avoid all that. Because if you stomp on our freedoms, that has one ending, and it's violence.